Welcome to the Schulich School of Medicine Head and Neck Clinical Examination video. In this video, we will show you the steps in performing a complete head and neck clinical exam. A head and neck examination includes the following components: inspection, examination of the ear, nose, oral cavity, neck, and cranial nerves. Inspection. Begin the exam with a thorough inspection of the head and neck, looking for skin lesions, masses, and asymmetries. Be sure to thoroughly examine the scalp and properly expose all areas of examination. Ears. The ears can be separated into the outer ear, middle ear, and inner ear. Clinically, different techniques are used to assess each component. Begin by inspecting each auricle and surrounding tissues for deformities, lumps, or skin lesions. Next, use an otoscope to inspect the ear canal and drum. Hold the otoscope in between your thumb and fingers like you would hold a pencil. If the otoscope contains a pneumatic bulb, place the bulb in the palm of your hand. To view the ear canal and drum, gently pull the ear up and backwards. Gently insert the speculum into the ear while bracing your little finger on the patient's face for any unexpected movements. Examine the ear canal for any discharge, foreign bodies, swelling, or redness. When examining the eardrum, look for the following landmarks: the incus, the malleus, the pars tensa and flaccida, and the anterior cone of light. If hearing loss is suspected, a conductive versus a sensorineural hearing loss can be distinguished using the Weber and Rene test with a 512 tuning fork. For the Weber test, set the fork into vibration by striking it on a hard surface. Firmly place the tuning fork on top of the patient's head. Ask if the patient can hear the tuning fork on both sides and if it is louder on one side. In unilateral conductive hearing loss, the tuning fork is better heard by the affected ear. In unilateral sensory hearing loss, sound is better heard by the normal or unaffected ear. To clarify the results of the Weber test, the Rene test is performed. The base of a vibrating tuning fork is placed on the mastoid process behind the ear. When the patient can no longer hear the sound, quickly place the fork close to the ear and ask if the patient can still hear the sound. Normally, patients will still be able to hear the sound conducted through air. In conductive hearing loss, sound via bone conduction lasts longer or equal to air conduction. In sensorineural hearing loss, the normal patterns will still prevail with air conduction lasting longer than bone conduction. Nose and paranasal sinuses. Begin with a brief inspection looking for any obvious masses or deformities. Test for nasal obstruction by pressing on each side of the nose in turn and asking the patient to breathe in. Next, palpate on the frontal and maxillary sinuses for sinus tenderness. Finally, examine the nasal mucosa by using a nasal speculum. Identify the septum and the middle and inferior turbinates. Note the color of the mucosa and any swelling, bleeding, or discharge and deviation of the nasal septum. Oral cavity. To inspect the oral cavity, use two tongue depressors and proper lighting. Gently use the two tongue depressors to expose and inspect the following components: buccal mucosa, gums, teeth, oral mucosa, tongue, and oral pharynx. Note for any masses, ulcers, or areas of discoloration. To examine the neck, begin with inspection, noting any masses, lesions, or asymmetries. Orient yourself by visually landmarking the area of the thyroid cartilage, cricoid cartilage, and the area of the thyroid gland. Begin by palpating for lymph nodes in the following regions: preauricular, postauricular, occipital, anterior cervical, posterior cervical, submandibular, submental, supraclavicular, and infraclavicular. Next, examine the thyroid. Begin by palpating for the thyroid cartilage. Move inferiorly to feel for the cricoid cartilage. Moving further down will bring you to the area of the thyroid gland. Palpate laterally on either side to feel for the lateral lobes of the thyroid. Note the size, shape, and consistency of the gland. Finally, ask the patient to swallow to feel the thyroid gland rise underneath your fingers. Complete the exam by auscultating over the thyroid gland, listening for bruits. Cranial nerves. For the purposes of this video, a brief screening cranial nerve exam will be demonstrated. To begin, cranial nerve 2 can be tested by examining visual fields by confrontation. Ask the patient to cover one eye while maintaining eye contact. Slowly bring your hand into the center along the plane between you and the patient. Have the patient indicate when they see your fingers. Assess all four quadrants of their visual field in each eye. Next, examine cranial nerves 3, 4, and 6 by testing extraocular movements. Slowly move your finger by making an H pattern to test the 6 cardinal directions of movement. Ask the patient if they experience double vision and note for nystagmus at the extremes of gaze. Proceed with testing cranial nerve 5. Use the tips of tissue paper and gently touch the patient's forehead, cheeks, and lower jaw. Note any areas with decreased sensation. Test cranial nerve 7, the facial nerve, by instructing the patient to move various aspects of their face. Cranial nerve 9 is tested by watching the rise of the soft palate. Cranial nerve 12 can be tested by having the patient move their tongue, while cranial nerve 10 can be tested with a gag reflex. Finally, cranial nerve 11 is tested by having the patient shrug their shoulders and turn their head against your hand. Thank you for watching this video. We hope that you have found it useful and enjoyable.